Hi, I'm Alice Journo, and this research was supported by the TNQ Drought Hub and supervised by Dr. Brian Lowe, Dr. Tracy Ahan, and Dr. Madeline Pardon. It explores the factors influencing health professionals' confidence to manage environmental trauma from extreme weather events. Climate change is no longer a distant concern. It's here and it's affecting us now. Australia is particularly vulnerable to climate-related disasters such as droughts, heat waves, floods, bushfires, and they are all increasing in frequency and intensity. 80% of Australians have experienced a natural disaster since 2019. These events pose significant physical and mental health risks. More than half of people affected by a disaster say their mental health has been impacted. Health professionals, regardless of their occupation across Australia, are on the front lines, managing both immediate and long-term consequences of these events. Yet, their readiness and confidence to deal with climate-related trauma remain underexplored. 30% of people feel there isn't enough mental health support available after disasters like floods and bushfires and droughts. Research is lacking on the factors that enhance resilience in affected communities. Health professionals often lack specialized training in environmental trauma, relying instead on their general skill set. My research investigates how confident health professionals feel in managing these mental health challenges and what makes them feel more confident. I focused on three key factors. First, self-efficacy, the belief in one's ability to succeed. Second, their personal experience with extreme weather. And third, professional training. So either simple participation or the fact of feeling competent after a professional training. To answer my question, I conducted a cross-sectional survey of 52 Australian healthcare professionals, including nurses, psychologists, and social workers. Data were collected via an online questionnaire which measured their self-efficacy, personal experience with extreme weather, and the perceived competence from professional training. A key measure was the self-reported confidence in addressing climate-related trauma. Standard statistical techniques, including multiple regression analysis, were used to analyze the relationship between these variables. Training by itself didn't have a big effect on boosting confidence. However, when professionals felt capable after training and believed in their own abilities, this explained most of the differences in confidence levels, about 77%. So believing in one's abilities alone accounted for 17% of the confidence differences. Interestingly, personal experience with extreme weather event did not make a difference when compared to the power of self-belief. It's clear that self-efficacy and a strong sense of competence from training are essential for boosting confidence. This means that if we want health professionals to be prepared for the mental health challenges caused by climate disasters, we need to develop competence-driven training programs. These programs should focus on building practical skills, fostering real-world confidence, and ensuring continuous learning to adapt to the increasing pressures of climate change. These findings have important practical implications. First, healthcare training programs must do more than just deliver knowledge. They must build self-efficacy through hands-on experience, simulation-based learning, and positive feedback. This will not only improve the competence of healthcare workers, but also their confidence in facing mental health crises that climate change is increasingly causing. Looking forward, future research should focus on the quality of training programs and longitudinal studies to track how self-efficacy changes over time. It's also critical to examine the systemic barriers that health professionals face, such as heavy workloads and institutional support. By addressing these challenges, we can ensure that health professionals are equipped to handle the growing mental health impacts of climate change. In conclusion, as climate-related trauma continues to rise, the psychological preparedness of healthcare professionals will be crucial. Through this research, I hope to have contributed to the growing understanding of how we can better support those on the front lines of this crisis, so that they in turn can support those who need it most. Thank you for listening.